Let's speak now to Ray Douglas, a youth worker who works on the Minors Violence Programme and joins me now from Birmingham. And what we've seen in the last few weeks and months is that this isn't confined to a certain area of youth. It is a youth problem across the country now.
Definitely, and nothing new to any practitioners or academics that I've ever worked with. What you're starting to see is the burning down of society, as the famous African proverb says, if you don't induct young people into the village, they will burn it down to feel its warmth. So what you're seeing in the kind of more leafier suburbs and the more non-traditional, stereotypical communities where violence was high is pockets of violence. And as Minors Violence, we work nationally, so we get to see this.
Are we at some sort of tipping point now? Because it's all very well saying it's all about lacks of number of police on the streets, or there aren't any community centres where young people can actually meet. What is there one thing that you think is behind this dramatic rise?
I don't think the answer is a binary one. I think it's all the above, all the things you mentioned plus more. And like I said, you see the intersectionality of it now and the side effect of cuts, and whether it be youth services, whether it be police, whether it be employment opportunities. I mean, there's the other famous saying, you know, it's hard to start a riot if you've got work in the morning. So you've got like half term coming up, for example, Easter period. Where will these young people go across the country for the next 2 weeks while their parents are still at work in some cases?
Ray, if you were sitting in number 10 Downing Street, you had unlimited resources, what would you do? How would you tackle this?
I think we have to understand that we've had the reports, we've had the serious case reviews, we've had decades almost. I remember there was a street weapons commission in 2009 chaired by Sherry Blair. So we've had, you know, a lot of time in the sun to reflect on this. If we're going to address it as a public health issue, then we have to invest in it like a public health issue, remove the jargon, remove hiding behind the statements, invest in it like it's a disease. I call it a forest fire more than a disease. The break in the forest fire is something that we have to focus on. That's education, that's investment, that's making it some more statutory. As previously before I came on air, the MP spoke about it rise to that level of extremism, how we respond to extremism. There can be no kind of afterthoughts now. Schools, public sector spaces, you name it, all of us, the media, all of us have a role to play in this.
You talk of a health emergency. This is a crime emergency. That's what it is. A knife attack is a crime. The health emergency follows because you've got to treat the victims.
Very interesting you say that, but the knife element of it is the end of something else. So you can talk about issues around trauma, you see the emerging conversations around ACEs, adverse childhood experiences, deprivation. The knife, unfortunately, is the end result of something that went prior to that. That's why we talk about a public health response.
So if you're going to tackle the symptoms, you've got to address the cause, but as you say, that is, well, there are just so many aspects of that. This is so complex.
Of course it's complex. I mean, from a social return on investment perspective, the last reports I looked at, you know, a stabbing costs the taxpayer £300,000, a shooting 1.4 million. So marry that with the investment that's going into how we respond to it, how we prevent it. We work in primary schools, and some of the conversations we're having in primary schools, never mind secondary schools and colleges, some of the conversations we're having with young people, some of you parents out there would be horrified. Secondly, you know, I'm sitting in the city, my hometown, where we lost 3 young men, 3 teenagers within 10 days. All 3 incidents within 2 miles of each other. That is a tragedy, that is a tipping point. And we're seeing now across the country, week on week, more tragedies. And I'm going to say everybody, all of us, politicians, policymakers, media, practitioners, communities, parents, we have to have teachers, long, hard looks in the mirror and saying, are we responding to this?
I don't know if you heard Cressida Dick, the Metropolitan Police Commissioner, on LBC this morning, and she said, but of course there is a link to the number of police officers on the streets and the numbers of violent crimes. Is she right? If there are more police officers walking around Birmingham, your city, or anywhere, is that going to mean youngsters will be less inclined to walk around the streets with knives where they might get stopped?
Naturally, they could be less inclined, but any police officer will tell you you cannot arrest your way out of knife crime. any senior police officer, especially retired ones, you cannot arrest your way. So that's one lane. What we're talking about is, what about the 300 million plus being withdrawn from youth services? You know, what about those conversations? So as I mentioned at the start of the interview, the solution is not binary. We have to bring all these research, the knowledge that we've got, the experience together, and once and for all, roll it out like a public health issue with the investment, with the long-term sustainability, and then we will see a reduction.
Or else what? What happens if that isn't done?
Well, we have a 72% increase where I'm sitting. You see, quite often we've evidenced things like knife bins and statues. They are not working. What works is the interface between communities and practitioners, and how we peace build, how we, at the epicenter of this, how we capacity build communities so they themselves can support each other, they themselves can respond. Look at the trauma that's been left in these communities, look at the bereavement, who's supporting around that. So a holistic public health response allows us to have a holistic response.
Ray, really good to talk to you. Ray Douglas, thanks so much for your time.
Thanks for inviting me.